Welcome to Unbiased Science.
where we bring scientific method to the madness.
We're your hosts, Dr. Jess Dyer.
And Dr. Sarah Scheinman.
And today we are in the presence of public health royalty. So I am going to skip over all of the intro stuff that we usually do. Sarah and I, we do have a little bit of an update that pertains to the last episode that we recorded about hand sanitizer, but we're going to keep that for the very end. So without further ado, we'd like to welcome our esteemed guest, Dr. Jerome Adams, who is the former U.S. Surgeon General, and I'm pinching myself right now. This is just such an honor. So thank you so much, Dr. Adams, for joining us today.
Yeah.
Great to be here with you and looking forward to the conversation. You know, I tell folks that, yes, I was the former Surgeon General, but I'm always going to be a dad. And so these issues are incredibly important to me as a father of three kids. You know, it's not just something that I talk about to people. It's something that I'm dealing with in my own life, even as my two of my kids are now adults. They're in college, and they're having to make their own decisions about vaccines and about trust in public systems. So I'm really looking forward to the conversation we're about to have.
All right.
Awesome.
Let me just read this very impressive bio quickly before we dive in. We're both so excited to get to chatting, but before we do, Dr. Jerome Adams currently serves as Presidential Fellow and Executive Director of the Center for Community Health Enhancement and Learning at Purdue University. As the 20th U.S. Surgeon General and member of the President's Coronavirus Task Force, Dr. Adams led the nation's response to COVID-19 while commanding the 6,000-person Public Health Service Commission Corps. He is a board-certified anesthesiologist with a Master of Public Health who previously served as Indiana State Health Commissioner, where he led responses to Ebola, Zika, and the HIV crisis while successfully advocating for syringe service programs. Dr. Adams is recognized not just for his scientific expertise, but for his exceptional ability to communicate complex health information to diverse audiences. He continues to address critical issues, including the opioid epidemic, maternal health, chronic disease, and community health partnerships. Dr. Adams, welcome to the pod. Thanks so much for being with us.
Wow, you guys got my mom's version of the bio. That was a little long, and it makes me feel old. But you know, one of the things that I would emphasize, again, that's relevant to our conversation in case it doesn't come up, is that I really lean on my state and local experience, even though most people who know me now know me for my national role as United States Surgeon General. And I often had to explain to people when I was Surgeon General that, hey, the things you want me to do, I actually don't have the authority to do that because the Constitution gives that authority to the state. And so when I was actually Indiana State Health Commissioner, I had greater authority, a larger budget, far more staff, literally 100-fold, as what I had when I was Surgeon General of the United States. And so I think that's an important point for people to understand, that these conversations, even though we talk about national trends, really play out locally in terms of policy and in terms of choices and so on.
Love that. Major props to our local and state public health authorities. Absolutely. So, Dr. Adams, we kick off every episode with the same question, which is, what is a news item that caught your attention and why should people care about it?
Well, at the time we're having this conversation, the two biggest topics in the news are the recent elections that took place. And also the fact that from a health standpoint, the president seems to have made a deal with the GLP manufacturers. And why is that relevant to the conversation we're having today? Well, it's relevant because I think in the elections, you're seeing that the United States is pushing back against what they feel is overreach by the current administration. And I want to be clear, I'm not a Democrat or a Republican. I'm an independent, and I try to call things as I see them. I was hard on the Biden administration when I felt they were doing things wrong. and I've been hard on the Trump administration when I feel they're doing things wrong. But I feel America, or at least the people who voted in elections this past Tuesday, have expressed concern about some of the things you've seen, particularly at HHS. When you look at the ACIP committee being fired, when you look at the haphazard way that they have riffed people and then had to rehire some of them, when you've looked at some of the pronouncements that have been made by the HHS secretary, and then have had to be walked back. And so I think that's an important sentiment for us to be paying attention to. And then also the irony that you have an administration, at least thus far, who's been very anti pharmaceutical industry, anti traditional medications, and perhaps the biggest legacy that they will have is by making GLPs more widely available to people on Medicare, and in the United States. And so again, a lot of cognitive dissonance here that we've seen this week, but also I think a lot of people reacting to what's going on the federal level.
I love what you just said. You sort of depolarize things, right? You said you're not a Democrat and you're not a Republican. And we sort of try to take a stance where we're looking at things policy by policy, right? Issue by issue. And we're also not here to pass judgment or make any blanket statements or assumptions about people. So something that we say, just to bring it to vaccines, because I know that's what we're going to be talking about a lot today, is we like to remind ourselves the mother who chooses not to vaccinate her child, she thinks she's making the best decision for her child, right? And I think it's terrible when we in public health sometimes dismiss someone like that as being immediately anti-science or even anti-vaccine. Maybe that mother has some questions, right? And so let's address her concerns. So I'm just curious, you've been vocal about the need to validate people's concerns rather than shame them. So it sounds like we have real common ground there. Who do you think that there are certain groups that are most susceptible to vaccine myths? In particular, we've seen so much about vaccines and autism. Is there a group you feel is most susceptible?
Well, you led into this. Many of those who are most susceptible are parents of young children who find themselves at the intersection of two stressful experiences: new parenthood and the diagnosis of a developmental difference in their child. And they're seeking answers. And when information is complex, when it's incomplete, when it's conflicting, they may gravitate to explanations that offer a sense of cause or a sense of control at a time when they're wallowing in uncertainty.
Right.
So during my time as Surgeon General, I highlighted that the conversation around vaccine hesitancy isn't just about entrenched, and I'm doing my air quotes here for people who are listening to this, anti-vax individuals, but about people who have legitimate questions, legitimate barriers, and legitimate concerns. And in terms of demographic change, yes, the audience has absolutely broadened. Originally, many concerns arose in relatively affluent, internet-connected communities where misinformation about vaccines had traction. But over time, we've seen this narrative spread more widely into rural areas. It shifted from mostly Democrats to mostly Republicans, into communities with lower trust in institutions, and even in non-English speaking settings. Fear, lack of trust, misinformation remain, but the reach is far wider. And that's what concerns a lot of us from a public health perspective. So yes, the myth still resonates with those who feel uncertain, underinformed, distrustful of institutions, but the who has expanded beyond what, in many cases, was the classic stereotype of the blueberry picking, granola eating mom from Oregon or California.
Sarah, I know you have a question. Do you mind if I just follow up with one quick thing, if I may? I'm super curious, Dr. Adams. Obviously, the MAHA movement has gained a lot of traction. Do you feel like that's having an impact on vaccine willingness to vaccinate, I'll say?
Well, I mean, so the answer to that is an unequivocal yes. The HHS secretary is the most powerful person on the planet when you look at the amount of money that HHS controls, their ability to fund research, their ability to drive public discourse, oversight over CDC and funding that goes out. And so RFK Jr. is using his bully pulpit to sow mistrust in vaccines, number one. Number two, he's using his authority as HHS secretary to sow mistrust in vaccines. Again, I mentioned earlier the disbanding and firing of the members of the ACIP committee, completely unprecedented. He's defunding infrastructure that allows us to vaccinate. And when you look at FDA, he's also changing the rules by which we vaccinate. And so in many ways, you have someone who has been a long-time vaccine skeptic. Some would say he really does fit into the category of anti-vaxxer, even though, to be fair, he denies that, who is now given all these incredibly powerful tools and levers, and he's leaning into them as hard as he possibly can, harder than what he ever pledged to during his confirmation hearings. He spent, it seems, an inordinate amount of his time attacking vaccines and taking down vaccine infrastructure.
Mm-hmm.
I mean, but even like beyond whoever is in power politically, vaccine hesitancy has been around for decades, right? So, Dr. Adams, I'm curious, what would you say to parents? Because, like Jess was saying, and we all, like Jess was saying, the parents who are hesitant to vaccinate their kids, like they still want the best for their children, right? Like that we all do.
Absolutely.
So what would you say to parents who are concerned about this link between vaccines and autism, and just parents that are just generally confused about whether vaccination is the right thing to do for their children? Like, what would you say to them?
So the most important thing that anyone listening can take away from this podcast is that people need to know that you care before they care what you know. And so the first thing that I would say to a parent is, I hear you. You need to acknowledge the concern rather than dismissing it. Many parents' fears, as you mentioned, are grounded in wanting the best for their child. And they're often navigating confusing emotional territory. So shaming and dismissing their concerns, it only pushes them further away. It pushes them into the hands of folks out there who really are trying to leverage this opportunity to sell supplements, to build up their social media followings, and to create opportunities for themselves. Second, I'd say, well, tell me why you think that, and let's walk through what the evidence shows. And what remains unknown. I think we have to acknowledge the unknown out there. We have large, well-conducted studies that repeatedly show vaccines do not cause autism. I'd explain how the timing of the vaccine schedules and the typical age of an autism diagnosis can create the appearance of a connection even when none exists causally. I would share with them that I, as a parent, believe that vaccines, the benefits far outweigh the risks, and that I've gotten my own child vaccinated. But here's what I always end with. I encourage people to talk with their trusted pediatrician or specialist, because studies show that trust in healthcare institutions is rapidly falling, but that people still trust their doctor, their nurse practitioner, their pharmacist, someone who knows their child's health history. And I tell them to ask, what is my child's risk of the disease versus their risk from the vaccine? What are the benefits of vaccinating on schedule? What are the known risks, and what misconceptions might I be hearing? And so if we do that, if we validate, if we listen, if we validate the source of their concerns, even though we may not validate, their conclusions, if we actually share where we are and how we've walked through these questions, and if we encourage them to talk to someone who may actually have more credibility in their eyes because they're their local doctor, nurse, or nurse practitioner, then that's the way we can get people to a place where they're making decisions based on science, based on their circumstances, and ultimately based on what's best for them.
Beautifully said. It's so interesting because recently that autism causation myth has expanded from vaccines to now we're hearing things about acetaminophen or Tylenol. Super curious, what do you make of this pattern of, expanding the blame, and what does this tell us about how health misinformation evolves?
Great question. And this is a classic pattern that we see all the time, especially now on social media, of shifting blame and health misinformation. When one explanation becomes discredited, example, vaccines cause autism, Rather than the myth disappearing, it morphs into new forms. And I see this all the time on social media. Let's say, well, what about this? Show me the proof. And then you literally go through and list the studies and the articles. And then they say, well, what about that? And it keeps on shifting. And it's because humans often seek a narrative, especially when something unexpected or unwelcome happens, like an autism diagnosis. They want a tangible cause. They want something they believe that they can point to or control or direct their energy towards. And when the first suspect is invalidated, the myth ecosystem will find a new target. And again, you pair that again with bad actors out there who constantly profit from providing new targets, and that's how we end up where we are. In practical terms, this tells us that misinformation is not one thing; it's adaptive. It shifts to fill the emotional and psychological need of fear, blame, explanation, and control. And back to the question that we talked about just previously, when we shame people, when we blame people, when we push them away, when we don't show them that we care, we actually throw kerosene on the fire of misinformation here and create more opportunities for this to persist.
So why do you think that like parents and society at large are like so desperate to find some sort of an external cause for autism? I mean, you were kind of talking a little bit already about like this need for control and blame, but how do these things continue to perpetuate these myths?
And why autism? Why are we talking so much about autism?
Yeah, why autism? I've always wondered that too.
Well, interestingly enough, I'll start at the end. Why autism? Because we're seeing autism diagnoses continue to rise, and because actually, relative to most other problems that children have, it's pretty prevalent, relatively speaking. And the diagnosis can feel overwhelming. There's uncertainty about cause, prognosis, whether or not there was something the parents did or didn't do themselves. And so saying there's an external cause, a shot, a drug, an exposure, is psychologically easier for a parent than saying, we don't fully understand this yet, or there's something that I did or didn't do that caused this. That drive for control is human. It's powerful. And likewise, blame plays a role. If there's a cause, then there's something to be done. Someone to hold accountable, someone to feel justified, help them feel justified in doing rather than feeling helpless. And so I think that all those things come together, but it really is human nature combined with a diagnosis that is prevalent and increasing, combined with an atmosphere where we as health professionals haven't done the best job of communicating with empathy, combined with this new atmosphere of social media and people out there profiting off of misinformation, confusion, fear for self-benefit.
Right. No, it's interesting. We were talking last week about how this idea of wanting to feel like you're doing something for your child, and how, we'll go to the pediatrician and it's typically some viral illness that they picked up at school, but yet so many parents will still want to walk away with a prescription for an antibiotic, even though antibiotics don't treat viruses, right? It's just, you're right. There is such a psychological element there.
You want to do something. You want a cause.
Right.
Okay, they must have a bacterial infection, and as a parent, you want to do something. As a parent, you don't want to see your child hurting and feel like, okay, we don't know why it is, and there's nothing you can do about it, but wait.
Right. You want to be proactive.
So, Dr. Adams, we've seen some states like California, Washington, Oregon, my state of Massachusetts, they've come out and issued their own vaccine recommendations that may conflict with federal guidance. We've seen organizations like the University of Minnesota's CIDRAP, the Vaccine Integrity Project is another organization that has cropped up, and they're issuing their own recommendations and guidance. Where do you think? It feels like there's a lot of confusion and the public doesn't know really where to turn. So where should people turn for trusted information about vaccines?
Well, one thing I'll say, and again, I'm saying this in a nonpartisan way, I'm intending to mean this in a very matter-of-fact way. Trust in federal healthcare institutions is verifiably dropping. It was 90% a year ago. It's down to 82% this summer, according to polls, and I'm sure even less now. And you also have an administration who feels like these decisions should be made at the state and local level and not based on national policy. And so, whether we like it or not, we are going to see more of these regional coalitions, more of this local decision making. But as you mentioned, when national, state, and local guidance diverge, it can understandably confuse patients. So I advise turning first to trustworthy frontline sources. As I mentioned earlier, your pediatrician, your primary care provider, someone who knows your health history and the local context. At the national level, I do still believe the CDC remains a credible source for most things, but that's more and more in doubt. I was on at a meeting recently where a former high-level CDC official reluctantly said, I have to be cautious now about telling people to take what the CDC says as a gold standard. For state-specific questions such as coverage, local availability, school requirements, again, and I mentioned a lot of this plays out at the state level, check with your state health department. Most people's trust in their state health departments is still pretty high, or your state's immunization program. And when you see conflicting recommendations, ask your clinician which guidance is most applicable to my child given where we live and what my child's health history is. And then finally, I'd say we need to continue to lean into compassion and transparency, acknowledging uncertainty rather than pretending that it doesn't exist, because we lose trust, we lose credibility when we oversell, when we say things, out of our desire as leaders, as health leaders, to portray confidence and certainty, and then that turns out not to be the case.
No,
I'm so curious. I'm so sorry, Sarah.
I was just going to say, like, that last point is so important because, like, we're all scientists here. Like, we know something that, like, a lot of people in the general public that have not necessarily engaged actively in the scientific process before would know that things change constantly with new data and new information. And that's not necessarily reflective of any kind of a failure. It's just reflective of the nature of science itself. Things are always evolving, always changing.
Well, and I think it's an opportunity for us to reflect on the fact that we haven't done the best job of educating our country in regards to science and the scientific method. One of the things we can do at a 30,000-foot level and looking long term is have these conversations in elementary schools about how you actually conduct an experiment and how you tell good information from misinformation. I think everyone, we should be encouraging more science fairs so that kids understand, okay, how do I actually understand the different variables at play? How do I understand, when something has been disproven? How do I continue to have healthy doubt about something instead of feeling certainty when certainty shouldn't be there?
The one thing that, you were saying, sort of pointing people to their trusted clinicians, and that's the same, we do the same exact thing. But it's interesting, we do have some clinicians who follow unbiased science, who they'll say they can't keep up and they're sort of struggling themselves to keep up with some of the changing guidance. So I don't know that there's an easy answer to this, because there's obviously a lot of confusion right now. But I'm wondering if there's, where do those individual clinicians go? Is it typically like the professional medical organizations like AAP and ACOG and those groups? I don't know if you have any thoughts or guidance for clinicians who might be listening.
Well, my thoughts are that I share your concern. So we often frame this through the lens of parents having questions, but we forget that doctors relied on the CDC and the FDA to give guidance. And so they're in limbo now. And that's where, again, these regional coalitions that are popping up, along with national organizations that you mentioned, like AAP and AMA and APHA, are stepping into the void. I wish we were in a place where there was one central trusted entity, i.e. the CDC, that everyone could go to, but we're going to have to evolve and we're going to have to adapt. And I do still believe there are trusted sources out there. And as physicians, as nurses, as pharmacists, we're going to have to lean on those trusted sources, even as trust in the CDC and the reliability of the CDC goes down.
Whew, it's a lot to unpack here. I have one more question before I let Sarah maybe ask our closer, which is having served as US Surgeon General during the pandemic, the vaccine rollout, what about the current situation, 2025, what is keeping you up at night about the current state of vaccine confidence? Is there something in particular that, really stands out to you?
Um, well, what keeps me up at night are the ripple effects of declining confidence. It's
Mm-hmm.
not just about one vaccine, about COVID or about measles or about Hep B or one disease. It's about the erosion of trust in the overall public health system, the
Right.
possibility that we're going to see preventable outbreaks of diseases we once controlled, like measles or polio, because complacency and fear have taken hold.
Mm-hmm.
And the speed at which misinformation spreads, especially online, where false claims are viral before accurate ones are even drafted, that concerns me. And so we need to get better at understanding how to leverage these new platforms. I remember when I first became Surgeon General, and it was taboo. It was literally considered taboo. People criticized me for being on Twitter as much as I was. But that's where most people are getting their information, on
Right.
TikTok, on
Right.
Instagram, and that's where the misinformation is spreading. And so that concerns me, that our willingness and our ability to learn about, to train our young professionals and to utilize these new mediums of
Mm-hmm.
communication, are again adding fuel to what is already a raging fire. And finally, I worry about equity. The communities that are already burdened by health disparities will be hardest hit by further declines in vaccination, and worse outcomes will follow.
Mm-hmm.
So ensuring we don't leave any community behind is a major concern. And more than anything, that's probably what keeps me up the most at night.
Mm-hmm. Mm-hmm.
Okay, so we just covered what keeps you up at night. Now I'd like to ask you, what helps you sleep at night? Or like what's giving you hope right now in public health and science? We like to end our episodes here with like a little bit of a lighter note.
Positivity. Yeah.
Well, here's what gives me hope. What gives me hope is that, um, as you mentioned, we've seen these trends for a long time. There were a couple of big um, catalysts, like the pandemic,
Hmm.
and like RFK, but these trends have been going in the wrong direction for a long time. And so now we're finally having conversations about, okay, what does it mean to lead with empathy? What does it mean to use clear and simple language? And we weren't doing that before. What does it mean to make vaccination as easy as possible for folks, and to lower barriers? And so I'm a big believer in Ryan Holiday. The Obstacle is the Way. His book. The idea that there is opportunity in crisis, and we have to acknowledge that the status quo was not very good for a lot of people out there. And so while I'm not going to be Pollyanna-ish about the danger, the threat of the moment, I also see some real opportunities for us to truly reflect on what was wrong, and to figure out new and better ways forward. I'm also interested in, and this is an entirely different podcast for us to have, but about technology and AI, and its ability to help us with communication, its
Come
ability to
back.
help us with drug discovery, its ability to help us with targeting, figuring out the communities that are most at risk, through AI. And I was having this conversation on a panel this week. We can figure out which communities are most at risk or are dropping vaccination rates in real time. We can scan social media and figure out, okay, what messages are they getting in real time. We can come up with the best counter messaging that is culturally appropriate at the educational level and in the language that is most likely to appeal to that target audience. And so there's a lot of opportunity out there for us, to be able to counter messaging and really improve health moving forward. So those things give me hope, and the young people give me hope. I teach at Purdue University, undergrads, and then I still practice medicine, and teach residents and medical students at Indiana University. School of Medicine. And the young people out there, they're brighter than ever. They're more enthusiastic than ever. And I think we're going to be all right in the long run, even as I acknowledge we're going to have some pain in the short run.
Dr. Jerome Adams, thank you so very much for all you've done and continue to do for public health and for joining us today. Thank you.
Thank you for having me.
Thank you so much, Dr. Adams. And thank you all for tuning in. We hope you learned a thing or two. I certainly did. Please join us next week on your trusted source for no nonsense, just science.
Okay, so we just recorded with Dr. Jerome Adams and sort of like shook off all of the excitement, and we wanted to jump back on because we got a couple of really great questions, comments about last week's episode with Dr. Jomana Musmar. And in that episode, so we were talking about things like antimicrobial resistance, and hand sanitizer came up. And we just wanted to clarify something. So there's a little bit of maybe confusion, and maybe we could have made clearer that, well, I'm going to say some things, and Sarah, I'm curious, like, jump in and tell me if you would change anything I'm saying.
Sure.
But
yeah, absolutely.
hand washing reigns supreme. That's always the go-to.
Right. No one has ever disputed that washing your hands with soap and water for 20 seconds is always, if you have that available as an option for you, that is always number one. That's
the thing. That's the best thing. But sometimes we don't have that as an option. Sometimes, let's say if like you're going into an encounter with a high-risk individual, you're going into, I don't know, you're visiting your grandma at the nursing home, whatever it is, let's say, obviously, ideally, you go wash your hands, but sometimes people don't have that option, so they'll reach for hand sanitizer. And that is like second best, right? But I think what Dr. Musmar was saying is that during the pandemic, it caused a whole lot. It changed, I think, a lot of our psychology and our behaviors. And many of us are almost like overusing hand sanitizer. And that's what Dr. Musmar was talking about. Sarah, did you want to clarify anything?
Heavy and repeated use of hand sanitizer being the key words here. And the reason why she was mentioning that this could potentially lead to antimicrobial resistance is that bacteria, just a quick microbiology lesson, as bacteria are very versatile organisms. They're like potentially like the most versatile organisms in like the entire universe. Like they can survive in very extreme environments, like our highly acidic stomach or like, you know, geothermal vents or whatever. So if you constantly are using hand sanitizer, like alcohol-based hand sanitizer, you run the risk of like potentially selecting for bacteria that can survive in that type of like highly alcoholic microenvironment. So that's the key, is that heavy and repeated overuse of hand sanitizer might cause that to happen.
And interestingly, when you're using hand sanitizers, you want to use that like 70% alcohol mixture, because there was this really interesting study. We could link to it in our show notes. It was published in Science Translational Medicine. I think this was a couple of years back, that showed that some strains of bacteria have begun adjusting to alcohol-based hand sanitizers. So it says they're not resistant to the alcohol, at least not yet, but they're becoming more tolerant of it. That means the bacteria were able to survive for longer periods of time after being doused with alcohol. However, the researchers used different strengths of alcohol concentration, starting with 23%, which that seems really
That's very low.
But eventually, when they got to the 70%, it says the bacteria were conquered. So that's also another thing to note. So this isn't saying like you don't have to toss your hand sanitizers. It's still something good to have in our arsenal. Hand washing is best, but just to clarify a little bit more, you bring a little bit more nuance to that discussion.
Yes.
Do we, I think that was good, right, Sarah?
Yeah, that was good. We got it.
All right. Hopefully that answers your questions. Thank you so much for submitting them. And we really do love receiving your feedback, your questions, your comments, and all that good stuff. So thank you so much, everyone.
Thanks.
Bye.